So now, ask your question again.
Okay, so they have it per file, so
Uh-huh.
they usually use the barium instead when they say it's an iodine allergy.
Mm-hmm.
What would they do? I mean, what do they do? Because they can't use the barium.
Okay, and so if they're allergic,
They, quote unquote.
they're allergic to that contrast
Yeah.
material?
Yes.
Okay, so there is a difference between how that contrast material is being administered. If it's administered intravenously, the body reacts differently to it. It reacts to it much quickly, much faster. Okay, but if it's just seeping out into the surrounding tissues, then they're not as concerned about that.
Okay.
Yeah, and they'll probably go ahead and still use it. But to inject it intravenously, that's a whole different. When you inject something, you gotta be very careful what you inject into somebody's body, because they could have an allergy to it. And, it's a very serious thing. But just ingesting it, that's a whole different beast.
That's when you would just counteract it with the Benadryl, right?
That's right. They use Benadryl and prednisone and maybe some epinephrine if it gets real serious. That's a whole other, that contrast, there's a lot to contrast materials, so we're going to save that for another class. What color does it show up on the image? Iodine. What color? It's kind of clear. What color would it show up on the image? It would be white. Yeah, wherever it goes, it's going to look white. Okay. Iodine has a high atomic number. Therefore, it will absorb the primary beam, and it will look white on your image. Iodine looks white. Which brings us to our next one. What does IVP contrast physically look like? What color is it?
Clear?
It's clear. Okay, it is perfectly clear. But it has iodine in it. So what's it going to look like? Even though it's clear going into the patient's body, what's it going to look like on the image?
White.
White. White on the image. So, you see barium, and barium is white when it goes into the patient, and it looks white on the image. So it's not the color of it that makes it turn out a certain way on the image. It's what's in it. If what's in it has a high atomic number, it will look white on your image.
So IVP has a high atomic number also.
IVP has iodine in it, which has a higher atomic number, so it's going to look white. Yep. Okay. The last one is air. And air looks what color? Black. Nothing in there to attenuate the primary beam. It's going to go straight through it, and it's going to look black. All right. I think we covered that pretty good. You guys have any questions on that? All right. Body habitus. Body habitus. So this is really nothing more than having a small, medium, and large patient. Generally, when somebody gives you a technique, they would give you a technique for an average size patient. Okay? And then it would be up to you to use your judgment to go up or down from there. So body habitus is really a fancy way of describing the size of your patient. That's what body habitus is referring to. So body habitus just refers to the size of your patient. And these are the four sizes right here. Hypersthenic, sthenic, hyposthenic, and asthenic. Sthenic would be your average size patient. Sthenic. Okay, so it all kind of revolves around that one. That's the word that's in all of the other ones. Sthenic means average size. And then we can really kind of take it from there if you've had any medical terminology in the past. Hyper is referring to what?
So we want to avoid saying fat.
Yeah, that would probably be a good idea. Hyper is, increase in size. So a hypersthenic patient would be a very large patient. Okay, hypersthenic. And then what's hypo? What does that refer
Low.
to? Yeah, that's like below or less. So that would be somebody who you would consider them to be thin, as opposed to being average in size. And then how about A? A is what? is without. Yes, A means without. So asthenic means really kind of without size. Asthenic would be somebody who would be like anorexic, very, very grotesquely thin. And that would be asthenic. We don't see too many of those patients. Mostly we see sthenic and hyposthenic. That's usually what we contend with. Okay, so there's body habitus. Any questions on that? You'll be talking about this again in procedures. All right, we're done with that stuff. Soon.
Thank you.
All right, that little unit, that's my least favorite unit of the whole semester.
Which one?
The one we just finished, the one on how patient factors affect density. And the rest of the stuff's a little bit more interesting, I think. First one is MA. So you're familiar with MA. Okay, Linda has talked about that. Linda and Todd have talked about that in procedures a little bit. I'm going to talk about it a little bit more right now. And then in Imaging 2, we'll take it to another level. And then when we get to physics next year, you'll completely understand MA. So we have a ways to go with MA. So we're going to try to keep, I'm going to try to keep it as simple as I can for right now. So milliamperage, MA, little m, big A. You have to always make sure you write it that way, little m, big A. So there's a question for you, and I'm thinking that you might be able to pull this answer off with what you've learned so far. So what function does the MA setting perform when you set your technical factors? What does MA do? Jeff?
Adds more current to the circuit, thus making more X-ray.
That's right, that's exactly what it does. MA is current, MA is electrons. Those electrons eventually are going to be turned into a quantity of X-rays. MA is electron. MA is really, MA is current. Current is electrons. And at some point during our exposure, those electrons will be converted into X-rays. It's a very complicated little process. So if we increase the current, we are going to increase the number of electrons that we have. And what's going to happen to our X-ray production? It's going to go up. Okay? We increase current, increase electrons, increase X-ray production. If we increase X-ray production, what happens to density? Darker. Yeah, density will go up. Okay? And of course, the reverse is true. If we go down in our MA, our density will go down. Good. Okay. So there are three really technical factors, aren't there? There's MA, there's time, and there's KBT. Those three technical factors. So I want to know how accurate do you think the MA settings are on the machine? How accurate do you think they would be? Where does this current come from?
The wall.
Comes from the wall, and then from there it comes from where? From where?
Florida Power?
Yeah, it comes from Progress Energy, doesn't it? Okay, so it's Progress Energy's job to get us a certain amount of current out of that wall right there. And depending on current usage of that current, we might get a little bit more, a little bit less. So my point is, what comes out of that wall fluctuates. And haven't you all seen that, where the lights kind of get dim for a second, then they get brighter again, like maybe during an electrical storm? Okay. Well, we don't quite know for sure what they are sending us. So the least accurate part of our technique, by far, is the MA setting. That is the least accurate part of our technique. We have a hard time controlling those electrons, the quantity that we're receiving, and then the quantity that we're using to produce our image. It's the least accurate. Even with that being the case,